Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy here in Tustin, California. We realize many of you have been on the search for solutions to your unresolved chronic pain. You've been to acupuncturists, massage therapists, chiropractors, and even worse yet, you may have had surgery and haven't gotten any better. I ask you, don't lose hope. Over my many years, I have found that there's 6 strategies that need to be addressed to get to the root of your problem. So don't settle for anything less. Come on in and let me show you what we have to offer. This 6-point strategy is what we like to think of more like a recipe for success. Let's use cooking for example. If you add the right ingredients at the wrong time, it can really ruin a dish. But if you add it at the right time, then the key flavors are accentuated. Let's go into the 6 points with a little bit more in depth now. We like to begin with the internal mobility. That includes mobilizing organs and nerves so that they can move freely during mechanical movement. We address the internal first because these structures can obstruct and slow the healing process. Once the organs and nerves are free and no longer restricted, we can move on to the external mobility. Joints, muscles, and connective tissues often need to be free. And this is where most therapies begin, but without addressing and clearing the internal mobility structures first, then muscles and joints often return to their dysfunctional state. We use such techniques such as functional manual therapy, soft tissue mobilization, and muscle tone relaxation. The next important step is neuromuscular connection and reflex. Structures are often healed physically, but connection between the brain to body is lost. And no matter how strong your muscles are, if it's not being used at the right time, then you're essentially weak. We like to use a comparison here like the internet, 4G LTE versus AOL dial-up. Which one would you rather be? 4G LTE can handle more bandwidth, more stress, and AOL is slow and things can often disconnect. So that's what we want to do. And when all these 3 things are efficient, external, internal, neuromuscular connection, we like to move on to performance. Things such as static performance, such as sitting, standing, and sleeping. And then next, we like to move that into dynamic performance. Those are things such as activities you all want to return to: squats, sit to stand, climbing stairs, exercises. But the most important is the thread that runs in between it all. We believe the 6th and last point of our care is you, the patient. Things such as your concerns, your goals, your habits need to be addressed to give us the most comprehensive care and holistic program possible to address your unresolved needs. So please don't settle for anything less and come in to Rehab and Revive Physical Therapy to check these points out.